Hi there, welcome back. Let's review paralysis today. Paralysis is a loss of muscle function in part of your body. It can be temporary or permanent, partial or complete, and can be localized or generalized. Paralysis can affect any part of your body at any time in your life. If you experience it, you probably won't feel pain in the affected areas. So, what are the symptoms? You lose feeling in a specific or widespread area of your body. Sometimes a tingling or numbing sensation can occur before total paralysis sets in. Paralysis will also make it difficult or impossible for you to control muscles in the affected body parts. There are various types of paralysis depending upon how we look at it. Localized paralysis affects only one part of your body, such as your face or hand. Generalized paralysis is a group of conditions that affect multiple body parts. It may be monoplegia, which affects only one arm or leg, hemiplegia, which affects one arm and one leg on the same side of your body. Then you may see in the medical records what is called paraplegia, which affects both of your legs. And then you may see in the medical records what is labeled as quadriplegia or tetraplegia, which affects both of your arms and both of your legs. Types of paralysis, you can see Bell's palsy, that is the paralysis of the facial nerve, usually benign with partial or complete recovery. Another type would be cerebral palsy, that is a non-progressive neurological disorder characterized by spasticity and incoordination of movements, sometimes associated with mental retardation and or seizures. Cerebral anoxia and premature birth may be contributing causes. So that's about the cerebral palsy. So enough on the types of the paralysis. Let's talk about the causes. Some people are born paralyzed, unfortunately. Others develop paralysis due to an accident or a medical condition. Stroke is the leading cause of paralysis in the United States. It is responsible for nearly 30% of the cases. Spinal cord injury accounts for an estimated 23% of cases. Multiple sclerosis causes an estimated 17% of cases. Other causes of paralysis include cerebral palsy, post-polio syndrome, traumatic brain injury, neurofibromatosis, birth defects, benign or malignant tumors arising in the brain or spinal cord, and infections such as poliomyelitis, osteomyelitis, diphtheria, untreated syphilis, tuberculosis, and encephalitis. How about the diagnosis? To diagnose the paralysis is often easy, especially when your loss of muscle function is obvious. For internal body parts where paralysis is more difficult to identify, the doctor may use X-rays, CT scans, MRI, or other imaging studies. If you experience a spinal cord injury, they may use myelography to assess your condition. In this procedure, they will insert a special dye into the nerves in your spinal cord. This will help them to see your nerves more clearly on X-rays. Your doctor may also perform an electromyography. In this procedure, They will use sensors to measure electrical activity in your muscles. So that's what it takes to diagnose the paralysis. Treatment includes surgery or possible amputation, unfortunately, physical or occupation therapy, mobility aids such as wheelchairs, braces, mobile scooters or other devices, and of course meds such as Botox or muscle relaxers if you have spastic paralysis. Spastic paralysis causes your muscles to shrink and become flabby. It results in muscle weakness. Spastic paralysis involves tight and hard muscles. It can cause your muscles to twitch uncontrollably or spasm. So, having said all that, how do we underwrite? Look for the cause of paralysis, any pre-existing or comorbid conditions, extent of disability, degree of self-sufficiency, attitude and adjustment to the condition, any excess alcohol use, substance abuse, tobacco use, bowel and bladder function, any recurrent or chronic infections, particularly respiratory, urinary and skin, as you read medical records. Compile and correlate all those details and plug it into your underwriting manual or internal company specifics to arrive at the best possible offer based on the present evidence. So with that, let's take a break here and see you soon. Take care. Bye now.